Even before they enter full menopause, women could suffer from symptoms actually of bad sleep, irritability, and actually more difficulty to relax. All of that is usually caused by an imbalance between female hormones, which would be progesterone and estradiol. And it is related to a symptom that we call premenopausal syndrome or perimenopausal syndrome, which is produced by that lack of progesterone. Just for the sake of clarity, let's look at the following graph. If you divide the cycle in three different moments, the first one starting at the beginning of the period, the second one being at the moment actually the egg is produced, and the last one being in between the phase of the production of the egg and actually the following menstrual period. When you look at the level of hormones in the blood, you see that at the beginning, the estradiol, which is here depicted in blue, is low, as well as progesterone, which is also very low. So both are low in the first phase of the cycle, which means not so much energy, but at the same time a good balance. So women feel rather okay, but they're not at their peak. Actually, just before the ovulation, before the egg is produced, there is a surge in the level of estradiol, while actually progesterone is still low. So that is translate actually in the behavior like more excitability, and actually women are more in the mood to try to find a sexual partner. They have much more energy, sometimes they lack a bit of sleep, but the morale is rather high. And in a few days following that moment, the estradiol level is going to lower down, the progesterone is going to increase, and there's going to be a plateau of hormones which are going to be balanced but at a higher level, which is in between the ovulation period and actually 3 or 4 days before the next beginning of their period. That level is usually the level at which the women feel the best. Actually, they have lots of energy, but they still have actually the ability to relax. And just in the premenstrual period, where actually progesterone falls down and estradiol is still high, there is a feeling of withdrawal, as if actually they are craving for something and they have still energy but not as much ability to relax. And that's a period where they feel much more irritable, where actually life is more difficult to cope with. Actually, what is going to happen in the premenopausal syndrome is that premenstrual syndrome is going to lengthen. Why? Because there is no production of egg in quite few months. So actually some months the woman will produce, some months she won't produce any egg. So whenever there's no egg produced, there is no progesterone produced, and it's as if the premenstrual syndrome actually lengthened to be more, sometimes 2 weeks or even a bit longer. And women feel much more tired. They feel an inability to have a proper deep sleep and actually get relaxed. And that's where actually all kinds of symptoms appear which compromise the quality of life. That premenstrual syndrome might happen quite a few years before all periods have ceased. And as a treatment, one may supplement women with progesterone in that second half of the cycle to help them cope and actually have a better ratio between their different hormones. That rebalancing might last few months, a few years, until actually again there's going to be another imbalance which will happen, where actually the estradiol itself will not be produced as much by the ovary, and then they will need both estrogen plus progesterone to feel better. Many times physicians do not prescribe any medication before the advent of a completed menopause. However, that has a tendency to increase a lot the consumption of medication to against anxiety, against depression, or for sleep in women that could otherwise feel much better if they would be supplemented.